Welcome to the Bedtime Browse, the channel where we transform your bedtime routine into a captivating journey through the vast and intriguing world of Reddit. Each episode is a cozy invitation to unwind, relax, and indulge in the diverse narratives woven across various subreddits. So, let's hit play, dim the lights, and embark on a bedtime journey through the wonders of the internet. Sweet dreams, and happy browsing. Doctors of Reddit, what was the most craziest thing you found in a patient? Not a doctor, but EMT. We transported a patient from a psych ward with Pika one time. He had a fist-sized lump on his stomach. The patient claims they are nickels that he ate. The jingle from the physical exam and hitting bumps in the ambulance confirmed they were coins. The patient ate so many nickels that they were visible on the outside of his body as a lump on his abdomen. How he got like $20 in nickels in the psych ward is a mystery, however. My husband's an EM doc. If it's something that you can even kinda imagine sorta maybe fitting up in certain regions, he's had at least one, if not multiple, person managed to fall in the shower in such a way that things magically aligned and it ended up lodged 3 miles up their butt. Flared bases, be important. While working in the ER, I had a patient come in with a screwdriver for eyeglasses stuck in his urethra. He claims to have picked up a girl at a bar, brought her back to his place, and he must have blacked out from the alcohol during the activities. Apparently she didn't like that, so she grabbed the screwdriver off his nightstand, shoved it in there, and left. He woke up the next morning and it had gotten sucked all the way into his perineum. You couldn't even see it anymore, but you could feel its outline during the physical exam. NAD, my mom works as an RT at a hospital. A guy was doing work on his roof and fell off, but landed on a huge stick. It went straight through his neck. Very closely missed anything vital. He snapped the rest of the branch off and drove himself to the ER. Took care of a patient in the ICU who went in for routine urologic procedure, ended up having complications leading to abdominal perforation. He ended up with an incision from below his sternum all the way down to his pubic bone. Since he had active infection draining pus from his abdomen, they left the wound open and packed it with cotton to wick out the infection. Needless to say, that guy was absolutely fricked, but he eventually recovered and walked out of the hospital. Mary, Mother of God. I had a patient with severe dementia, essentially nonverbal, come in with infection of unknown origin. Nurse noticed blood in her diaper. Speculum exam revealed a foreign object, one of those small devotional statues. Apparently, the patient was very Catholic and had several in her room. And yes, Adult Protective Services was informed. Former trauma radiographer. Had an elderly woman present via ambulance from a local nursing home with an obviously fractured hip. Took the scout pelvic film and noticed she had put her false teeth inside her vagina, and safety pinned her labia together. She was also wearing Victoria's Secret underwear that spelled "sexy" across her behind in rhinestones, so, yeah. That was a fun moment at the processor. My brother had a guy come into his ER several years ago, and found an infection in his urethra. Upon further examination, this guy intentionally stuck a catheter in to bypass the urinary tract, and the other end was hooked up to a bag of wine. Yes, he made it so he pees out wine as a party trick and people drink it. WTAF. I'm not a doctor, but my father is an ER physician. He told me a story one time about how a young adult man came in with his mother complaining of severe stomach pain. The young man claimed to not know why, so my dad ordered x-rays. Turns out there was a mannequin hand lodged in this man's prostate, maybe? I'm not a physician and he told me this story years ago, so I can't exactly remember. Young fella was fisting himself with a mannequin hand and lost it up his bum. The colon and the prostate do not communicate with one another, but you can stimulate the prostate from the rectum, which is why that young man put a mannequin hand, I imagine. Worst case scenario, the mannequin hand eroded through/punctured the colon, and then perhaps punctured the prostate. That would cause a life-threatening infection within a day at the most and require some very delicate surgery to fix. Not a doctor, but I have to look at x-rays in my role in patient treatment. Dude had a bit of a run-in with a tree stump grinder. There was a straight-up small branch embedded in his calf that said, most of the calf was hanging off his lower limb, and he had to go in for surgical debridements of the leg almost daily because trees are not very sterile and have a lot of splinters. Ophthalmologist here. I saw a schizophrenic patient who was smearing feces into his eye. He had a really bad corneal ulcer. TLDR, poop in eye. Oh, my dental hygienist told me a couple one made her laugh while telling. So we're limited to the mouth. One was a small grown-up vegetable of sort, so probably a seed ended around the teeth and grown. The other made her curious about an abscess she was working over, since the patient was described as clean and no other big problems, so cleaning and cleaning, the cause came out. A hair. By the shape, and the reaction from the patient, which attributed it to the natural toothbrush, it was evidently a pubic hair. Woman came into the ER, complaining of severe abdominal pain. On ultrasound, they found 2 rolls of camera film in her vagina. She looked shocked and said that she put them up there 4 months prior and must have forgot to take them back out. Well, when I was posted in the forensics department during my medical school, I once got the opportunity to see a slug lodged in the trachea of a dead man. Yep, that's how he had died. He choked on a slug while trying to eat it whole and raw. Oh, and he also had 2 chilies in his pocket, which the residents assumed he was gonna eat while eating the slug to make it more spicy. There was a case in Australia a few years ago, where a kid ate a slug on a dare and ended up dying of the parasitic infection the slug had. Took years and it destroyed him physically and mentally. Don't eat raw slugs, folks. If they don't choke you to death, your brain will still turn to mush. As a dentist, we are used to seeing unerupted teeth still stuck in the bone, which we call impacted teeth. The third molars are notorious for this. And after them, the canine teeth also get impacted. We confirm this when we see the radiographs of the patient. I was seeing this radiograph of a colleague's patient who had a missing canine which we were expecting on find impacted. We were not able to find it and thought it was missing. On closer inspection, we saw it impacted just below the eye lying horizontally. Posted this before as well. Man, facial x-rays of children creep me out with all those teeth in their jaw. That, and any imaging of someone with Cherub's disease or syndrome. Nightmare fuel. EMT here. I've had a homeless guy who complained about numbness and inability to move his legs. Upon further inspection, there was more parasite and bacterial infection than leg. Literally had to use a trash bag to prevent the maggots from getting everywhere. Xylazine is a heck of a drug. Drug paraphernalia / drug packets aren't uncommon. I saw someone get an entire beak of a giant lawn art chicken statue stuck in their eye. That was unique. 3 limes. One on top of each other encased on a condom. Unfortunately, not a doctor, just the friend who delivered the lime man to the ER. My mom was an ER nurse and someone had shoved an entire wine bottle up their butt. The bottle created a giant suction, and it had started to pull their intestines out when they attempted to remove it. They had to drill a hole in the base of the bottle to kill the suction, and then remove the bottle from their butthole. It was a Pinot Noir at least. Gonorrhea of the colostomy, where the patient was letting others stick their docs for MTH money. It wasn't a doctor, but I got my flared butt plug stuck in my butthole and was so embarrassed I called my best friend over to help me get it out. She's big into anal stuff with her hubby, so I knew if anyone was able to help me, it would be her. My husband got home a few hours later and I said, while you were at work, Bestie had to come pull my butt plug out of my butthole. He was very grateful because at the time his BIL was the ER doctor, here, LOL. I have a frequent flyer who enjoys systematically inserting needles and straightened out paper clips up his urethra and then coming to the hospital to get them removed. Friend is a nurse on psych ward. Had an old guy who liked shoving AAA batteries in his urethra. 24-inch dildo into the colon. It reached the left upper quadrant, near the ribs, of the abdomen, from the rectum. I was honestly impressed. Edit, it was beige-colored, with poop. Edit 2, there is a CT scan. X-ray tech, here. We had one where a patient stuffed a bottle of maple syrup up his butt, and you could tell the brand was Aunt Jemima, from the X-ray. As an intern I saw a patient with a horrible open abdominal wound that wouldn't heal, and horrible hygiene with no self-care. He came into the ED due to abdominal pain, and we found about 12 maggots buried into and crawling in his large open wound. Not a doctor, but a former Navy corpsman. I had a patient come in a few weeks after shooting himself in the femur with a nail from a nail gun. He was on the roof and started to lose his balance, and apparently instinctively placed the nail gun on his leg to keep himself upright. He fell off the roof, pulled out the nail with a pair of vice grips, but couldn't get all of it. He thought it wasn't a big deal until one day he was casually walking and his femur snapped in two. Just a medical student, but during one of my rotations in the ICU, we had this patient who had not one but two strokes within a 24-hour time period. When he first came to the ED, it was clear he having a stroke, but his symptoms were relatively mild, some numbness in his fingers, mild difficulty speaking. He didn't think anything was wrong, so he left against medical advice, before we could do any serious workup. He came back later in the day with much more severe symptoms, and so he immediately got spirited up to the ICU, which is where I saw him. On his MRI, it showed signs of watershed strokes, which are a special kind of brain injury, which indicate the brain as a whole is not getting enough blood. We typically see this type of stroke in severe trauma patients who have lost large amounts of blood, but this guy didn't have signs of blood loss at all. We did some more advanced imaging and what we saw was that he was missing both his carotid arteries and one of his basilar arteries. Normal people have two of these that run up from the spinal cord into the brain, so basically he only had one tiny blood vessel perfusing his entire brain. The end result of this was that whenever his blood pressure dropped the slightest amount, his brain would get starved for oxygen and he would have a stroke. The real kicker? Even after being admitted to the ICU and being on multiple pressors to keep this blood pressure up to prevent him from stroking out, he still wanted to leave against medical advice. Late to the thread, so this will probably get buried. Disclaimer, I am a doctor, but this happened years ago in medical school with one of the cadavers we study anatomy on. Not a live patient, but I still thought it was pretty crazy and definitely memorable. In the preclinical years of medical school, most medical schools have students enroll in anatomy lab where we dissect cadavers as part of the course. One of the anatomy labs had a cadaver who had passed away from complications from kidney failure, according to the identification tab. While that anatomy team was dissecting some of the leg and buttock muscles, they found a small caliber bullet in the gluteus medius. No idea how it got there and totally unrelated to the cause of death. I like to imagine the guy signing paperwork to donate his body to science, thinking that the med students dissecting his butt would get a funny surprise, lol. When I was cycling, I had a freak event where a bee flew into my mouth and stung my uvula. Rode 8 miles back home with what felt like an awful sore throat. Checked in the mirror and stinger was still lodged in. Went to urgent care after where a doctor had to numb and remove it with tweezers. After successfully removing it, he said he has never heard of it happening before, and we had a laugh about it. Overall 4 out of 10, unenjoyable for sure, but not the worst thing I've ever experienced. Was riding with two people who were very allergic to bees, so would have been likely deadly for them. If you want proof, check my post history, lol. I can't remember where I saw this, if I read it or saw a video, but there was a case of a woman who went to the ER with a glass Coke bottle in her vagina. The bottle was empty, and there was no top on it, and at some point during penetration fun, the bottle sealed itself to her vaginal wall or cervix or something, and she could not pull it out. They ended up having her stand on 2 chairs, straddling a guy with a cordless drill so he could cut a hole in the bottom of the glass and equalize the air pressure. Thankfully, the bottle glass was thick and tough and the drill was sharp enough that the bottle did not break. But holy OG, what an afternoon that must have been. A few years ago, when I first started working in the ER, a patient came in with severe rectal pain and bleeding. Upon inspection, he had large and visible hemorrhoids, so the reasonable assumption was that he had an internal one that burst and was the source of the pain and discomfort, right? Well, turns out the patient had been experimenting with a gaping device and was placing wine glasses inside his anal cavity. The device was cheap and plastic, which when he was startled by his mother walking into the room caused him to flinch and flex his sphincter closed and broke the device and the wine glass inside. They managed to get the device out of him, but had to come into the ER to have the shards removed. Anesthesiologist here. Few years ago, we admitted a young guy, think he was 15, for a surgery consisting in retrieving a huge black dildo in his descending colon. The thing is, our battery was still on and the Mamba was vibrating when I had to start my induction and told the guy, think about something pleasant. To get something up there, at least 25 centimeters from the anus, he admitted, after all, he used another dildo to push it that far. Fortunately, the surgeon managed to get the beast out of him without cutting through his abdomen. He inserted his whole arm and managed to grip it from its base. The area is naturally well lubricated. I won't say here what the surgeon said after all. He was kinda mad to be out of his bed at 2 a.m. to fill his arm up some teenager's butthole. Thank you for joining us on this captivating journey through the digital wonders of Reddit. If you enjoyed our subreddit explorations and want more bedtime tales, don't forget to hit that like button, subscribe, and ring the notification bell to stay updated. We love hearing your thoughts and suggestions, so drop a comment below with your favorite subreddit or share your own stories. Let's keep this conversation going. Until next time, sweet dreams and happy browsing.